issues. Good afternoon. I'll talk about evidence-based budgeting, current situation, and issues. As for the contents of my presentation, I'll talk about the need for evidence-based policy evaluation, and then also take a look at the systems that we have in place in Korea and what kind of policy experiments would be needed for evidence-based policy evaluation and look at some of the cases that have been done in Korea and then look at the issues. First, Korea so far has focused on economic growth, but after we have managed to grow to some level, we are now paying attention to meeting the diverse social demands, and fiscal policies are now playing a more important role. And there is an increasing pressure for fiscal spending, but the physical resources are limited, meaning that we have to look for effective ways to implement our fiscal policies. Under such circumstances, designing our policies based on evidence is becoming more significant. So evidence-based policy making is to make the policies work in a way that can achieve the original objective. And out of various policy alternatives, we want to pick the one that has cost effectiveness based on some objective evidence. So based on evidence-based policy making, if we can carry out the policies based on such approach, we would be able to reduce the waste in our fiscal spending that can be caused by ineffective policies. So in the process of budgeting, in order to introduce the evidence-based policies, we are carrying out preliminary feasibility studies and pre-assessment, but we are seeing some limitations in these activities because if we're trying to evaluate the effectiveness of a project in advance, it's difficult to predict the reaction or feedback to such policy projects. So another problem that we see is that for the projects that are already being carried out, it's very difficult to pick a comparison group. So that could limit the credibility of policy evaluation. So we wanted to look at some pilot programs. A pilot program is a small-scale project that is done before the full-scale program is carried out to verify the effectiveness of the program. So it is all about creating evidence to justify expansion to the main program, and also to increase the effectiveness of the main program by making specific policy suggestions. When we look at the evaluation process of such pilot programs, each departments are given authority to evaluate their own pilot programs, but there is no guidelines for the evaluations offered. So let's take in order to have more thorough and detailed self-assessment results, we have looked at the pilot programs that have been carried out by the Ministry of Health and Welfare, Ministry of Employment and Labor, Ministry of Education over the past 5 years. And we have identified a total of 40 pilot programs, and most of those pilot programs had a period less than 1 year, and many of them had the budget less than 10 billion won. And 25 out of these 40 pilot programs has been carried out by the Ministry of Health and Welfare. So the first limitation that we identified that when we looked at whether each pilot programs had evaluation reports produced afterwards, we have looked at 4 years, and out of 32 pilot programs, only 10 pilot programs had proper evaluation reports, meaning that a majority of pilot programs are going without proper evaluations. And another limitation we identified was that even if a pilot program has been evaluated, the level of evaluation was low. And that reduced the credibility and objectiveness of the evaluation results. 66.7% of pilot program evaluations did not have any control groups, and only post-period was examined. And it was not an evaluation that compared before and after the implementation of the project. It only looked at the post-implementation results, and 50% of the pilot program evaluations were done in qualitative assessment. They only looked at the level of satisfaction of the recipient of the pilot programs, and because of these limitations, evidence that were proposed were far from having enough level of credibility and objectivity. The third limitation was that the cycle of budget was not in line. The evaluation cycle was not in line with the budget cycle. So the evaluation results could not be properly reflected in the budget cycle. Here we looked at pilot programs that were done by the Ministry of Health and Welfare in 2017. Most of the pilot programs were expanded after the pilot programs, but most of the programs were ended in November, December, and January next year, meaning that these pilot programs, many of them were completed after the budget cycle was finished, meaning that evaluation results were not properly reflected in the budget cycle. For pilot projects to be able to provide evidence for deciding whether to expand to the main program or not, there were some certain limitations that we identified, as I've explained before. And in Korea, we also have preliminary feasibility study, and it's called PFS. And it is applied for large-scale projects that cost more than 50 billion Korean won. And it is about whether to carry out this project or not. So it's about providing the budget information by going through preliminary evaluation of the projects. And this study was first introduced in 1999 for large-scale infrastructure construction projects. And from 2010, it was also applied to non-investment physical sectors such as social welfare, labor, and environment policies. So this is a chart that shows the preliminary feasibility studies for social welfare policies. And if you look at the three boxes in the middle, they are the evaluation criteria, and they are economic and social analysis. Second is to look at the appropriateness of the program design. Third would be related to cost effectiveness of the program. And welfare and income transfer also has policy factors, and these policy factors are reviewed. So it is also difficult to evaluate the proper policy effectiveness before policy evaluation. And the preliminary feasibility study was revised in 2019. So the focus was not on deciding whether to implement the project or not, but to provide policy alternatives to improve policy effectiveness. So the preliminary feasibility study has definitely changed in this process. And in the case of pilot programs, pilot program evaluation and preliminary feasibility studies are done separately, and pilot program evaluation results were not properly utilized in preliminary feasibility studies. Because pilot program evaluation and preliminary feasibility studies are carried out simultaneously, the pilot program evaluation results could be used only after the preliminary feasibility studies were finished. And the projects for preliminary feasibility studies had different program plans, and this made it hard to use pilot program evaluation results in preliminary feasibility studies. So in the evidence-based budgeting, of course, we realized the importance of evidence-based policies, but in order to improve the quality of evidence, to make the evidence stronger, we realized that we should have more information to build the evidence. And we realized there is room for policy experiments. And as Professor Kim Boo-yeol has mentioned, this is mainly based on random control trial to look at the effectiveness or relevance of policies. So the benefits of such policy experiment would be that it would be able to look at the ex-ante effectiveness of the policy so that there can be quite precise assessment of the effectiveness of the policies. And after a pilot project is carried out, the policy alternatives can be made. So the project alternatives could be more specific and precise. And third, in the case of randomized controlled trial, by simple comparison of the control groups and treatment groups, we will be able to provide more intuitive information that could be useful in persuading the policymakers. Last but not least, evaluation results of policy experiments, even if they are not reflected right away in the imminent policies, they will still be valuable as an inventory of information that could serve for future policy decisions. In the case of Korea, we've had a few number of policy experiments before that were conducted in the past. One of the pilot program was Durunuri Social Insurance Subsidy Program that were implemented between February and June of 2002 to reduce the coverage gap in Social Security. It was applied for low-income people working in small companies, and 2 candidate counties were selected from each of 16 provinces, respectively, and selected as a treatment group and a control group. And the evaluation data here would be administrative data from the National Pension Services and National Employment Insurance. And according to the researchers who actually studied this, there was a small increase in the number of recipients, but the increase was quite limited to around only 1 or 2% increase. However, existing recipients already had a lot of social security. And in 2017, the researcher and also based on 2012 report, the same results were presented. And such results were not properly reflected in the main project because main project was carried out right after this policy experiments. And it was only in 2018 when major improvements were adopted. And as for the second policy experiment, this was really related to earned income deduction for basic livelihood security systems. And it was implemented from 2001 to 2003. And the goal was to raise the work incentives of welfare recipients by deducting some income from their basic livelihood security systems. And 10 areas were subjected, and control group had the income deduction applied, and the treatment group had the deduction methods applied, and the control group did not have the income deduction applied. So there was the control group and the treatment group. And here, administrative data was used to identify their income level. And at the same time, many low-income families members work in temporary jobs. So here, we also looked at the survey data about monthly work status from the recipients. And we also asked the public officials about how they predict the income level of these recipient families. And as for the evaluation results, in groups that had 30% earned income reduction rate, there was a significant increase in earned income. But right after the pilot program, such income deduction rate was not applied. But in 2019, the only thing that was proven to be effective was the 30% earned income deduction, and it was actually introduced in BLSS and has been used since then. And as for the policy experiments that we have made, well, those are sporadic cases that have been done in the past. But for those policy experiments to be used in a more systematic manner, we have identified certain challenges. And the first challenge would be to create incentives for line ministries to conduct policy experiments. But when we looked at the government ministries level, they could only see as an increase in their workload, or they might not feel so good about having their projects so thoroughly examined. And because of that reluctance, such policy experiments might not be widely welcomed by the line ministries. So in that regard, we have to figure out a way to provide incentives for line ministries to participate in policy experiments. And when we look at the case in the United States, in the 1980s and 1990s, there has been major welfare reforms done at the state level. And state governments were incentivized by the federal government. So in a way that they were exempt, they were asked to bring the experiment evaluation results. So policy experiment on state welfare programs were used as a basis for the welfare reforms in the 1980s and 1990s in the United States. And as for the budget cycle and pilot evaluation cycles, there is a need to match these two cycles, and we need two things to do that. And first is that when a pilot project is planned, policy experiments should be designed at the same time so that policy experiments and projects can be designed simultaneously. And when a policy evaluation, project evaluation is done, it should also be matched with the budget cycle. Third here is that there is a need for stronger evidence, and we have to use administrative data. And here we are looking at education, income, welfare data. In designing the policies, I believe evidence-based policy evaluation can be used widely, but policy experiments can be applied not just for the new programs, but also for existing programs. In the case of the United States in the 1990s, there has been various policy experiments, and 67% of policy experiments were applied to existing programs. And such experiments and state welfare programs were used as the basis for welfare reforms in the 1980s and 1990s. Such evidence-based policy evaluation is, I hope, is done in a more